same with like a relaxed
Yep.
diaphragm, whatever.
Whatever, okay. So, yes, there is a point of tension, right? So, we'll talk more about this, but I usually avoid the word posture. I avoid the P word, because what do you think of when you hear posture? Show me good posture. Go ahead. Show me good.
Of like
Right?
pushing your chest too far out.
So, when I hear posture, I think of it's very tight, good, everything is back and far, but sometimes it can be too much. If you end up pulling your shoulder blades too tight together, there's tension happening back there, and there's tension happening back here, and that's not going to be good for anybody, right? So I think more in the terms of balance. Okay, so will you please kind of shake out your arms a little bit? Okay, and shake out your leg. Okay, kind of like one of the suggestions in here was like a dog is biting your leg. Pull on your, get off, dog. Okay, so good. We're going to do a little exercise. I'd like you to, you're going to count down from 8. 8, 7, 6, 5, 4, 3, 2, 1. Okay, and then we're going to do, each time you count down, you're going to shake a body part to those counts. 8, 7, 6, 5, 4, 3, 2, 1. 8, 7, 6, 5, 4, 3. And then your legs. 8, 7, 6, 5, 4, 3, 2, 1. 8, 7. So we're going to go 8, 6, 4, 2, 1, 0. Ready? Okay, you got to count with me though. Ready? Here we go. 8, 7, 6, 5, 4, 3, 2, 1. 8, 7, 6, 5, 4, 3, 2, and 8, 7, 6, 5, 4, 3, 2, 8, 7, 6, 5, 4, 3, 6.
6, 5, 4, 3, 2, 1. 6, 5, 4, 3, 2, 1.
6, 5, 4, 3, 2, 1. 6, 5, 4, 3, and 4. 4, 2, 3, 4, 3, 2. 4, 3, 2, 1. 2. 1, 2, 1, 2. Oh, I did backwards. So you end up with some floppy people. Okay, so we want to make sure we are relaxed as possible, right? So when you breathe, we want to make sure that we are taking a comfortable breath. Okay, show me what a comfortable breath in will be for you. Go. Okay. So when you breathe, what am I looking for physically on your body? What do I want to see?
You like expanding from your stomach and not like
That's right.
raising your shoulders.
That's exactly right. So when you're breathing, I don't want to see, because there's nothing here attached to your lung. There's no reason that your shoulders should go up when you breathe. It's all down here, right? So blow out some air, everybody go. And breathe in, go. Right, exhale. Inhale, go again. And exhale. Who are some of the best breathers? You ever watch a baby breathe?
Oh, yeah.
Babies are excellent breathers because they've not yet learned how to do it wrong.
And they have big bellies, too.
Big bell, right? So you can see them very clearly. So often I have my singers lie on their backs. So they get a chance to breathe, and with disconnecting all of the spine and musculature. And so all I do is breathe. We're not going to do that now. Someday. Okay? So, will you please put your hand here? Put it here right underneath your belly button. And we're going to breathe in. Go and make sure this expands. Ready? Try it. Go. Exhale. One more time. Breathe. Exhale. Okay. So, our breathing, we want a nice low open breath, very relaxed and full. Okay, we talked earlier about letting our air just drop in our bellies, right? Our lungs. So we please put your thumbs right underneath your jawline right there and kind of gently open and go And now we're going to like open our mouths on the count of 4. Make no noise, and it's just kind of like a quick inhale on AH. Ready? 1, 2, 3. And blow it out. Out. Ready? And open up. Inhale. Harder in masks, yeah. Have you tried a singer's mask before? Have you used those yet?
Mm-mm.
Ever? Yeah. They do okay. They do a pretty good job.
Dr. Wynn always recommends a bunch.
Yeah.
And like chamber choir, or university chorale, or what have you.
Okay. Yeah, I've used this. I've used some of them. They're pretty okay. They give a lot more space for jaw opening, especially with that plastic bracket that I showed you that I use. It's very restricting for my opening. Okay. So say for me, ma, 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 right here. Thumbs up, go. Ma, ma. So as you are opening your mouth, make sure that you've got some movement there. Okay. A lot of times, younger singers are very clenched and tight. Ma, 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 So say for me again, ma. Ma. Very good. Yeah, we want to be as relaxed as possible. Okay. So we're going to talk more about breathing and how all of our ribs are connected and what happens to our lungs and where our diaphragm really is and all these fun things. So have a seat, would you please? Oh no, just squeeze it.
That one was having troubles the other day too.
Oh well.
My camel tried to use it.
Oh well. Okie dokie. So I've got a new PowerPoint today. Has a bit of some recurring slides, repeating slides. Excuse me. And you like that hat with the things, or the straw that comes down, and you want to put on my mask? That's what I need. Okie dokie. I remember my pointer today. Ooh. Okay, so some of these things will repeat from what we talked about the other day. Some will not. We're going to spend a lot more time talking to our friend for the camera. Whoa. Our friend Larry. Vocal anatomy and physiology. So these are a couple of slides we've seen the other day. Okay, we're alive. Instruments are dead. We change. We move. We pulse. Okay. So we're going to spend a lot more time now talking about the anatomy of our larynx, including all these fun things. There's only one bone included in the larynx, a hyoid bone. That's way up here. Way up here, this one here. Sometimes you can kind of feel it in there. Don't squeeze too hard. It's in there. Okay, so there's only one bone. Then there are a whole bunch of cartilages in there. So we've got the epiglottis is a cartilage. The epiglottis is a little different than the other kinds of cartilages because it is elastic and movable. It covers that space, our glottis, right? We talked about the other day how our epiglottis closes. So it is an elastic cartilage. The other kinds are called hyaline cartilages. We'll see if I have a marker that's going to work today. Hyaline cartilages. Okay. The next type of cartilage is the thyroid cartilage, right here, this big guy. Right here. This is where we notice the Adam's apple happening in males. Then we got the cricoid. The cricoid is the smaller cartilage here, down below. Thyroid, cricoid, hyoid bone. Okay. And then we've got some paired cartilages. Those are the singular ones that there's only one of. The paired ones are kind of in the back. We've got the arytenoids. That's these things here in the back. Arytenoids. Okay. And then the corniculate and the cuneiform are these small guys up here. The small dudes hanging out. The corniculate and the cuneiforms. Pairs. Now when you look at a larynx, we saw some videos already. It doesn't look like this, right? It's covered with layers of muscle and fat and skin and tissue and cells. Now the hyoid bone is suspended. It's not connected to anything else. It's just hanging out in there. So because it is suspended, it can move up and down with the larynx. The whole thing can go up and down. It can go forward and tilt and rock and sideways. Okay, and it connects to the thyroid cartilage, which we just talked about. Now, there's really no empty space here. It's actually connected with a ligament here that's happening. So our epiglottis is number 3 below here. That guy. And it closes off the airway to prevent choking. Yay, not dying. Okay, and the thyroid cartilage, the vocal fold's attached to the front of it. So this is a model just like I'm standing right now. So it points forward. So the vocal fold's attached to the front of it. That V you've seen before connects in the front, the anterior. So this is the front right here. This is the front. These are the back. And then this is flipped around. So this is the posterior, the back side, and that's the front. Okay, the cricoid cartilage found at the bottom of the larynx, and that it covers part of the trachea, the tracheal rings. Pardon me, I got a little tickle here going on today. Alright, so some people say, have you ever seen like a class ring or for college or high school, and it's got one side that's kind of small, so it kind of looks like that. If that's the back part, there's like the small part. So it looks like a class ring when you're trying to identify it. So here are the tracheal cartilages. They're just the little parts of the trachea that kind of help connect to everything and protect it. So the cricoid cartilage is right here below. The thyroid cartilage. Here's the Adam's apple, the laryngeal prominence. Okay, and this is a thyroid membrane. These big words are easy to remember because they connect 2 parts, and both parts are in that word. Thyroid to the hyoid bone. Thyroid membrane. So that's what's connecting here, the membrane. The first word is usually what is more secure and where things come from and where it goes to. It happens for membranes, and you're going to see that a lot with the muscles also. And these are the arytenoid cartilages, the ones in back. There are 2, 1 for each vocal fold. And they literally rock and roll. Those are the ones that, along with the muscles that attach to it, pull your vocal folds together. So this is, again, them in action here. You can kind of see they open and close, thanks to the arytenoid. And there, open, close, center, open. All thanks to the arytenoid cartilages. And the small little cartilages, the corniculate and the cuneiform, last I've read, they still don't know what they're for. In speaking and singing, they serve no purpose, except to kind of just hang out and tie things together. Kind of the top of the arytenoids. Okay, the reading for today that we'll kind of go over a little bit later, the Darty, the How Voices Work packet. It's longer probably than any reading you'll probably do in any one particular sitting. It's about 27 pages long, but it has everything you need to know about cartilages and muscles and how they open, how they close, how they get higher, how they get lower. Okay. So now we're looking down again. Here's the front, right? So the epiglottis is this person right here, this little cartilage here, and it folds down to cover. Within the larynx, there's something called the false vocal folds. So we know these are the true folds right here, but on either side, there's something called the false vocal folds. And someday we'll spend some time listening to some throat singing and how those can be used. But anytime, have you ever imitated Muppets before? You ever tried to be Grover?
Never
Yoda?
tried it.
Huh? What, you've never tried to imitate Grover or Yoda? When you there is no try, only do. Okay, that is using the false vocal folds. And the ventricles, just like the ventricle of a heart, just means a small space. Okay, and then here on both sides also these are your sinuses. The sinuses are just little cavities way back here. So when people ever say, how are your sinuses? They feel swollen today? That's what they're feeling for. Okay, and we've seen, I don't think is this a video one? Nope, not this one. So this is what we've seen before, the two vocal folds. Here are the arytenoids back here. Okay, those are things that pull them together. Epiglottis is down here. Okay, vocal fold layers. How are they made up? Right? So there are 3 sections that are shown here. And this is like thinking like up and down. Okay? So the epithelium is a very thin outside. Then the lamina propria has all of these layers inside here. Again, this is in your packet for your reading for today. It's very important. A lot of what you have on this packet will be part of your anatomy and physiology exam that you'll be having in a little bit. Like a few weeks, a little bit, not today. And the body, the vocalis muscle, this is the thyroid muscle here. Big muscle. Okay, and again, you have all those already. Here's another view, a little more, a sketch of it. Just a different way of looking at it. Now you get both sides. Okay, and again, it's looking up and down. So as tiny, as thin as those vocal folds are, all of that is happening inside of those vocal folds still. How does the voice work? Okay, what did we say adduction is? The other day we talked about adduction and abduction. What is adduction? Close. Add, together. Okay? So, adduction, so abduction is the opposite. Oftentimes when I really want you to hear the difference, I will say like AD, adduction, AB, abduction, just to make sure you can understand me. And we also talked about the onsets, the different types of onsets. So we talked about the glottal. So on the glottal onset, there's air pressure underneath the vocal folds. And then it explodes open. Okay, and then the aspirate, the breathy, it's almost, the vocal folds just remain open and they close just a little bit to make that sound, but it's very breathy. The air flows freely. And then there's the mix, the gentle, which is kind of the in-between. Hallelujah. I use all 3 for different accents, for different articulations. Each one is important to singing and choral music and vocal music. Okay, we saw this diagram also. The stroboscopy, the video one. The flexible is the tube that goes up with the camera and down the nose. And the rigid stroboscopy is one where you stick out your tongue and they stick a big camera on a stick in there.
You awake when they do that?
Oh yeah.
Wouldn't that make you throw up?
No, because it's not like, This isn't down like you towards your gag, where your gag reflex would be.
Oh. Okay.
It just goes straight back and has a camera that looks down. And even this has the tube dangles over here. So this is where like the epiglottis folds here. This is the
Yeah.
and so that's where it folds. So it just literally dangles above it. And they also numb.
Yeah, with that was one I had done, and they like spray the stuff
Yeah.
up your nose, and it like makes everything numb.
Right. Otherwise, yeah, you'd feel it. When they did mine, they didn't spray enough. I'm like, oh, I feel everything.
Yeah, I still felt stuff. It just like didn't hurt.
Yeah. Okay, and we've seen our video here of the right, they're closing together so much here. Here's the front. Arytenoids in back. Our sinuses, our spaces back here. These are the false vocal folds right here, these. False vocal folds. True vocal folds. And what is a glottis? Glottis. What is a glottis? What did you read? What is an epiglottis? Right? The epiglottis is this cartilage right here. Epiglottis. Okay? So, the glottis is just a space. There's no cartilage, there's no cells, there's no tissue. It's literally the opening. So this right here, this open space, that's the glottis. The epiglottis covers the glottis. Okay, now we start talking muscles here. So there are the thyroarytenoid muscles. We talked about the beginning and the ending parts of those words. Thyroarytenoid. Where is the thyroid cartilage on here again? Which one is that?
That's the big one.
The big one, right? So that's our first part, the thyro. And then the arytenoids, where are those?
Those are the little pinchy things.
Right, the little pinchy things. Okay, so there are muscles that attach from, and here it is, from the thyroid cartilage to the arytenoids, cartilages. Thyroarytenoid muscle. Okay, from where it starts to where it ends. And those, the TA, that can be abbreviated, TA, and those are shorteners. What happens when your vocal folds get shorter? What type of sound is created? Uh-huh. Vocal folds get shorter. What type of sound? Higher, lower?
Higher.
Higher, lower?
Oh no, lower, sorry.
Lower, right? So, lower. And so that makes up the bulk. So when the thyroarytenoid muscle contracts, it makes them shorter and thicker. And that makes a lower pitch. Okay, here's the front. Cricoid cartilage here. The cricothyroid muscles, CT, cricothyroid. And then for this course, if you abbreviate that, I'm probably going to know what you mean, but I'm going to want to know that you know how to spell it. So cricothyroid. From the cricoid cartilage up front to the thyroid cartilage. And those are the lengtheners. Okay, so here there are two sets. There's one on each side. Okay, so there's going to be a vertical and an oblique on each side of the musculature. A cricothyroid. Oh no. Okay, well I'll find a different pitch video that shows it. It's not going to play for me today. But you'll be able to see the vocal folds lengthening and shortening. How about this one? No? Fine, put that on. Worked at home. Okay. So I'll come back, we'll find all those. And then the openers and closers. So vocal folds can be opened, closed, lengthened, and shortened. Okay, so the cricoarytenoid muscles. Cricoarytenoid muscles. From the cricoid cartilage to the arytenoid cartilages. Cricoarytenoid, CA. So the posterior and the rear, the back of the larynx opens, the PCA opens, and the lateral thyroarytenoid closes. Lateral thyroarytenoid, LTA. Okay, and the interarytenoid muscles, those are the closers. There's two sets that close. Okay, so what does inter mean? What does the prefix inter mean?
Inter?
Mm-hmm. Like interstate. Interarytenoid muscle.
Within the state.
Between.
Between, yeah, within.
Okay, so between states, like the interstate takes you from state to state. The interarytenoid muscle is back here, between the arytenoids. Interarytenoid. Those are the closers we've talked about. Okay? So open, and then they contract. Open, contract. Okay? Interarytenoid muscles, IA. That's our IO muscle. Okay, and so back here, this is the interarytenoid muscle. There's one that goes straight across, and then there's some that cross. And crisscross. Okay, this is a nice diagram. It's pretty clear. It's got everything we can see very clearly. So here's our epiglottis still. We're looking from the back now. From the back, the epiglottis folds over. We've got our cricoid cartilage here, thyroid cartilage here, the hyoid bone up here, our thyroid membrane in front here. And this is our TA muscle, our transverse arytenoid. So this, I'm sorry, I said that wrong. These are our IA muscles, the inner arytenoid. So between the arytenoids, transverse means it goes across. Transverse. Oblique, cross at an angle, crisscross. Both interarytenoid. There's two types. Okay? And what do the interarytenoid muscles do? Open or close? I'm asking. Open or close?
Close.
Close. Interarytenoid, close. Okay. Because it's all about the music in this thing, the really cheesy music. So you can kind of see it's kind of getting blown apart and put back together. These are the cartilages of the larynx and the bone. Free-floating bone in the body. Okay, now we're from the side and the back. Right? Talk about by what they connect. we've got the thyroarytenoid. From the thyroid to the arytenoid, so it goes back here. You can't see, so that's the front, because it runs back here. Then we've got the cricoarytenoid, from the cricoid cartilage to the arytenoids, cartilages back there. And the cricoid thyroid, from the cricoid cartilage to the thyroid. Okay, and there's our IA muscles again. Both of those right here, the transverse and the oblique, are closers. So those are the muscles that are firing the lateral cricoarytenoid, transverse and oblique arytenoids, the IA muscles, the closers. That's what makes our sound. And the CT muscle, the cricoid thyroid, increases the pitch, like going up, higher pitch, increases a bad word. N. Ta-da! Okay. There are some pretty good resources. I'll make these available to you that talk about all those diagrams we just did, and they're very clear, and you can have them at your own leisure to print out or to look at on your digital devices. Phew. Now we talk breathing. We get away from our larynx for a little bit. We talked about the other day our power source. Okay? Our power happens in our lungs. Okay, I know you can't read all these, don't worry, you don't need to. How many pairs of ribs do we have? How many pairs of ribs? What do you think? What have you heard? What's a guess?
I'm gonna guess 10.
Really close. 12.
Really?
12. 12 pairs of ribs. Okay. Where is the diaphragm on your body? This kind of gives it away. Where have you always thought it was? When people, choir directors say, I want you to make sure you feel that diaphragm happening and flexing, where do you envision that was?
Like in your chest.
Your chest? Is that what you thought it was?
Yeah.
Wasn't where I thought it was. I thought it was lower. Because they always talk about that what does the diaphragm do? A couple different purposes. Yeah, it goes down. But what's happening when it does that? When you breathe, why can I see all your stomachs going out and in? Why can I see that? This is me smiling.
I don't know
What?
the words.
Yeah, okay. So
I think they changed her.
your diaphragm does a couple things. One, it creates a vacuum for your breathing. So when it goes down, it takes your lungs with it, and you get inhalation. So your diaphragm is always working. It's not something you turn on or off, only when you sing. And then your diaphragm also helps to push all your guts out of the way. All your viscera. That's why I can see this moving, because it's not your diaphragm, it's not your lungs that are expanding, it's your diaphragm pushing down and out on everything so that I can see your viscera moving out. Okay, so part of the musculature system, we've got the clavicle, which is this right here, runs across, it's clavicle. Your sternum is right here in the middle. Ribs, you got 12 pair we talked about. 7 pair of true ribs. And they're called true ribs. Why do you think? They taste good with barbecue sauce? Why are they true ribs? Do you have a guess?
It's because the other ones are too small.
Not entirely because of the size. What do you think, Veronica? Do you have a guess?
Are they like not attached or like in a different?
Well, those are attached, yeah, but that's it. It's because they are attached. So the true ribs attach all the way back. And they go all the way around. 1, 2, 3, 4, 5, 6, 7. And then you get some down here that are attached only through cartilage. You get 3 false that aren't really attached. They kind of branch off from another rib. So that's 10 pair, and then 2 are floating that are like attached just by cartilage down here.
Ooh, I want the idea of that.
Yeah, they're just kind of hanging out.
Yeah.
Yep. Okay, and then pardon my N over here. So the intercostal are like the muscles between your ribs that connect all this stuff together. Inter, between. And so you got the intercostal muscles. And all those muscles help with the contraction and for your exhalation and expanding for your inhalation. When you squeeze, exhale. And those help bring the ribs out for inhalation. Here's a good picture. Okay, so clavicle first rib, 1, 2, 3, 4, 5, 6, 7. And then these 8, 9, 10 down here, those branch off from these other ribs over here. See, they kind of expand here. They're connected to 8, 9, 10. Okay. And then, do you see what I'm talking about when I say false? Because all these connect, and these 8, 9, 10 don't connect to anything. Okay. And then over here, 11 and 12, those are the ones that are in the back. Those protect your kidneys back here. Someone knew what they were doing when they put us together. Okay? How does sound happen? We'll talk more about this later. There are a couple different theories and processes that help us to create sound. One of the, you don't write this down for me. You'll get it later. We'll talk more about this at length. Okay. But we got more science helping us make some sound. And then how voices work. So this is our 27-page document. I want to make sure you go back and read and understand where everything is and how to find things and up. Okay, it's an older document, but it's very helpful because it has not anything's changed really. So information about the larynx, where it is, talks about our hyoid bone. Now, there's a term sheet that I put on today on Blackboard that that's the stuff you'll have to know for your anatomy and physiology proficiency exam. But you won't have to know like the parts of the hyoid bone. Like this is not an anatomy class, right? We're going to spend like 2 weeks, 3 weeks about talking about this. We're going to move on. But you do got to know how they all work. Okay. So we talked about there's a small misprint here. These two are actually backwards. So we talked about we talked about the glottis. The glottis means space. Subglottis means underneath, sub, below. So when we breathe, there's usually subglottic pressure from air happening underneath that space, and that explodes to create the glottal start. Okay. Bunch of terms, purposes. Here we get some interesting things and important things. the scaffolding of the larynx. Here's all the cartilages. Here's where we talk about the different types of different types. So this is fairly important. The elastic cartilage moves. Okay, that's your epiglottis. The hyaline cartilage, that's everything else. And as we age, there's something called ossification. What is that? What is ossification of cartilages?
Like hardening.
Yeah, great, good job. So our cartilages are all across our body get harder and more brittle. That's why our voices aren't as vibrant as we get older, because it's all cartilage almost. So the elastic cartilages, epiglottis, will always be there for us. The hyaline cartilages get harder and make it more challenging to sing as we get older. Okay, several helpful diagrams in this packet. So as you are reviewing, this can be a great place to turn to review. The bones, the cartilages, the front, the anterior, the posterior views. Talk about the unpaired, the singular versus the paired cartilages. Like singular is like the thyroid because there's only one. Right? The paired are the arytenoid where there's two. So as you're reviewing and looking, really important stuff in here is the process of how these move. And that's further down, further down, further down. Where is it? There we go. So we get into the processes of the opening and closing and the different muscles that we use. So this was where you'll want to refer back to when you're looking to kind of review. And we'll talk more about this almost daily because we're going to keep on touching on this and learning more about how our larynx functions and how we make some sound. So on Monday, we're going to come back and learn about Bernoulli. Here's the end. Have a good weekend. Anything exciting going on? No? Nothing? Avoid the snow. Be safe. Be well.
Snow.